Thank you for joining us for another informative, educational, and entertaining edition of Music and Medicine with Dr. Charles Modlin, kidney transplant surgeon, board-certified urologist, public speaker, and well-known community national leader for the elimination of health disparities, dedicated to informing you, the listening audience, about important health topics and health information that you, your family, and your community need to know, while at the same time providing you with quality entertainment, because music and entertainment is medicine. Dr. Modlin's co-hosts are Jerome Brown and registered nurse Jonathan Branch, and the program often includes special content expert guests. So, without further ado, here is the host of the show, Dr. Charles Modlin.
Hey there, everybody. Thank you for joining in for another very informative episode. I know this is going to be very informative for you. Music and Medicine, that's M-U-Z-I-C, Music and Medicine. We're going to have back guitarist Jerome Mitchell. He's the guitarist for the Waiters Happiness Band. He's been on the platform before. He's a great entertainer. I've seen him live here in Cleveland. He's going to be part of our entertainment today. We have a very special topic. Before I get into that, I want to acknowledge and give praise and thanks. I don't know if you can see that. Praise and thanks to my beloved grandmother. She just celebrated her 130th or 137th heavenly birthday on February the 2nd. She was really a huge inspiration to me. I remember her daily. She was born in 1888. There are not many people who can say they knew someone from the 1800s, but I just wanted to recognize her. February the 2nd, 1888. So thank you, Grandmother Clara Hampton, for all you did in helping raise me, my siblings, and the love and courage and wisdom you imparted upon us, and for being a great role model. So today we have a very important topic that we're going to talk about. You know, in the news, there's been some national pushback on DEI, that's diversity, equity, and inclusion. Our topic today is why diversity, equity, inclusion is essential in healthcare, especially if we want to eliminate the healthcare disparities that disproportionately afflict people of color, and particularly African Americans and other underserved populations. Viewers of this platform, Music and Medicine, have heard me and my colleagues talk about health inequities and health disparities. We've gone into a lot of detail describing examples of health care disparities that, you know, as we've talked about, disproportionately afflict African American populations. Higher rates of high blood pressure, heart disease, diabetes, kidney disease, stroke, a number of cancers, prostate cancer, colorectal cancer, lung cancer. We've talked about all that on previous episodes. We talked about the multivariate contributing factors that contribute to these healthcare disparities, a lot of the social drivers of health, social determinants of health. Hereditary, genetic predisposition, some of the social determinants of health that especially contribute to the healthcare disparities that we see in African Americans in particular. Again, lower life expectancies in both Black men compared to their white male counterparts. Black females, Black men on average live about 6 years shorter than white males. Black females live about 4 to 5 years shorter than white females. But a big contributing factor is discrimination and racism. And that's resulted in a distrust that many African Americans have when it comes to even seeking healthcare, seeking preventative healthcare. We all know that early detection of disease can save lives, reduce morbidity and mortality rates. And the reason I'm mentioning all of this is because having a more diverse healthcare workforce can actually help improve communications between caregivers, doctors, nurses, other caregivers, and the community that we strive to serve, and African American populations. Because of the historical distrust, we've talked about the Tuskegee syphilis experiment. All of this has contributed to the pathogenesis of the healthcare disparities that we see. So we're going to dedicate this show to basically talking about how diversity in healthcare, it's really a life-saving imperative. It's not optional. It's something that is required. And we're going to talk about this. We actually have a incredible guest on. This is a very special guest. One of my colleagues from Metro Health, and I'm just going to read a brief introduction of Dr. Connie Moreland. Dr. Moreland was born and raised in Los Angeles, California. She attended the University of Washington in Seattle, Washington. Then she received her bachelor's in science in nutritional sciences and foods. She would attend Emory University, great university in Atlanta, Georgia, where she received a master's of medical science degree in clinical nutrition. During her time in Atlanta, she had the opportunity to work at the Centers for Disease Control, that's the CDC, as part of a large research team investigating severe undernutrition among hospitalized pediatric patients. It was during this time that she met her mentor, Dr. Phil Nieberg, the principal investigator and medical epidemiologist, and a Case Western Reserve graduate who encouraged her to attend medical school. She received her medical education at the Medical College of Georgia in Augusta, Georgia. She completed her residency training in OBGYN at Rush University in Chicago. And then she began her career as a staff in OBGYN in Chicago at Northwestern University, Prentice Women's Hospital. Go Northwestern. She ultimately, joined the Medical Faculty Foundation at Northwestern, where she practiced there several years. And ultimately, her desire to work amongst the medically underserved led her to the south side of Chicago, where she worked for many years as an OBGYN generalist. She's also focused many of her efforts on undergraduate and graduate medical education, serving as both an OBGYN clerkship director and program director for the OBGYN residency program at Mount Sinai Hospital. She joined us at Metro Health about a year ago in January 2024. And she serves as the inaugural Vice President of Medical Diversity and Inclusion at Metro Health. So she is a content expert on this topic of the importance that we do maintain and place a high emphasis on the importance of diversity in the healthcare sector for the elimination, eradication of health disparities. So with that being said, I want to invite Dr. Moreland onto the platform of Music and Medicine. Are you there, Dr. Moreland?
Yes, I'm here.
Yeah, I've learned a lot from you during your short time, 1 year stint at Metro Health. I consider you to be a mentor of mine. You have a lot great wisdom. So thank you for that. And I know you're going to impart a lot of wisdom on our listening audience. And you know a lot about this subject than I do. You're the content expert in terms of the importance of diversity, equity, and inclusion in the health professions. So tell us about what is your role, what's your job responsibilities at Metro Health? What are some of the things that you're working on?
Well, first of all, thank you very much, Dr. Modlin, for having me. It's surprising to me that you're thinking of me as a mentor because you've been in the Cleveland landscape for many, many years, and you're highly regarded and highly respected. So I'm looking to you quite a bit for leadership and mentoring. So I hope we're going to have a lovely conversation about music and medicine. And so my role at Metro Health, to be honest with you, it's a lot of fun. I have the opportunity to work with doctors, physicians of all backgrounds, and advanced practice providers, namely nurse practitioners and physician assistants. And in a way, I have an opportunity to get to know them very personally, and I have an opportunity to mentor them, encourage them, and try to inspire them as they do this very challenging work that we are called to do in medicine. And also an opportunity to study mental health and to try to develop ways to build stronger medical teams. A lot of the times, I think when we're in medicine, we talk a lot about health and what's healthy. And so when we think about teams of physicians and providers, we often have to refer to the same concept: what's healthy in terms of the provider and what providers look like, what their cultural backgrounds are in relation to the patients that we take care of. And so we don't have to guess anymore. We have data, we have information that shows us that when healthcare professionals, doctors, advanced practice providers come from backgrounds that are similar to their patients, either race, language, ethnicity, and other characteristics, even age, even ability status, that for whatever reasons, and we have some ideas about those reasons, the patients do better and we have better outcomes. So basically, we're focusing on building healthier healthcare teams so that we can have better outcomes for our patients.
So one thing I mentioned that you're an obstetrician gynecologist, so people may forget that you're actually still seeing patients and delivering babies. Actually, on a weekly basis, every week you take call. How many babies are you delivering every week, would you say?
Well, Metro Health is quite a busy place, contrary to what some might believe. So when I'm on call, I deliver anywhere from a couple babies to 6, 7 babies every night.
Oh, wow.
Yeah, so we're quite busy.
That was one of the most difficult rotations that I had in medical school. It killed me. We had to do 24 hours on, 24 off. It was quite an experience being able to, see the birth of a child. So, have you? I'm sure you have. Have you? You've been practicing medicine for quite some time. You've probably seen some children that you gave birth to or that you delivered, and years later you probably saw them when they were teenagers or a little bit older. Is that?
Well, yeah. I mean, I've been doing this so long that I'm now seeing some of my patients actually go to medical school.
Oh.
One of the young ladies that I delivered, her mother is a physician, a pathologist, and I delivered all 5 of her children. And she's got her oldest daughter now at Northwestern, and
wow.
she's a dermatology resident. So I've been doing it, I guess, long enough to see some of my own patients pursue medicine, and enough who are considering medicine as well.
Yeah, that's amazing.
Yeah.
So you talked about the fact that diversity, equity, and inclusion can help us build more effective healthcare teams. We've talked about the healthcare disparities, and I think we want to relate to the listening audience, to the nation, why DEI is important in healthcare. I mean, specifically, let's go into more detail. I mean, you talked about when patients see healthcare providers that look like them, racial concordance. And, the fact is, we're not saying that every patient needs or expects or is required to have a doctor that looks like them, of the same race or ethnicity or language. But in many situations, patients are more comfortable if they see somebody that looks like them. We know the literature and just from our own experience that when there's racial concordance, and only about 5% of African-American physicians are African-American physicians, only about 5% I think about 5% are Hispanic also. The evidence, the research, the data shows us that when there's racial concordance, there's the quality of the communication between the healthcare providers and the patients that they serve is better. There's patients feel more at ease. They feel more that that's a safe space for them to express themselves. With improved communication, that leads to improved health outcomes because better health literacy, better understanding, better follow-up, better compliance on the part of the patient. Would you agree with all that? Is that what you're seeing also?
Yeah, I think that as you well know, we have shifted from what we believe in anecdotal, I guess, concepts, or just the one by one sort of concept of practicing medicine, to looking at what the aggregate data, what do the studies, what does the research show us? This is our way of validating and documenting what we perceive as the truth. And so when we study patients who are being seen by physicians who are like them, in a variety of characteristics, including race, including ethnicity, including language, we see that those patients do better. And then when we talk about the African American, of course, we have a long history in the United States of um, receiving health care in a system or in systems that have not always earned our trust, have not always been trustworthy, and we still remember. We've not outlived those memories. We have individuals who are still, they have family members that can remember some of these abhorrent studies that they participated in. And so there's quite a bit of mistrust still for the healthcare system. So there are a good numbers of African Americans who will seek out and who prefer to have providers or doctors, healthcare professionals who are like them. And like you said, maybe 4, 5, or 6% of all physicians are African American. And so we know that we cannot only rely on African American doctors. So we do have to, at times, focus on the characteristics of the physician. Are they respectful? Are they caring? Are they competent? Do they have the skills? Are they board certified? So there's a lot that goes into selecting a physician.
Hmm.
But we do know that, again, the data is pretty clear that when we study Black people and others, we see that when physicians are like them, they do better. And so when we're trying to have better outcomes, we're trying to have improved outcomes, especially when we look at certain populations, particularly African Americans, and we see that we don't have as good of outcomes overall. We want to do things that will increase the our outcomes or improve our outcomes, and one of them is to try to identify physicians that are concordant or like our patients, particularly African Americans.
One thing I've seen, and I'm sure you've seen this also during your career, individuals in the community who are not even my patients will rely upon me to provide them my opinion about what their medical situation might be. They're obviously seeing other physicians, but they'll walk up to me, they'll approach me. Maybe some friends or connections I have will call me and ask me to call and speak to somebody, because there's a greater sense of trust and reliability upon me as a Black physician, even to discuss with them a situation that's not even within my specialty. I'm a kidney transplant surgeon and a urologist, but there's a great reliance that the community has upon Black doctors. Also, I mean, the research and evidence does show that it's the African American doctors who are the ones most likely to go back and serve the Black community. So
Yes,
it's very
I agree
important.
with you 100%. And I want to throw a little bit of a curveball in here. I agree 100% that, I'm an OBGYN. I do have many patients who ask me questions about medicine in general, outside of the scope of my expertise. And I will go that extra mile to try to understand and to try to refer them to the right provider to get them the information that they need. Since I've been in Cleveland, I will say that I feel like I've gone back just a little bit in time.
Hmm.
I do remember when I started practicing medicine in the 90s, late 90s, 97. Um, the way that patients received me, it was, it was very welcoming, and sometimes a little surprised that they had an African American female physician.
Right.
And over the years, I kind of got used to the fact that people accepted me as a physician, black, white, whomever, and I didn't receive that sort of surprise as much that they had a black physician when I worked in Chicago.
Hmm.
But since I've been in Cleveland, I'm sort of reliving those early days again. And so what it does is it speaks to the fact that we have more of a scarcity of physicians of color here in Cleveland, especially Black or African American physicians. And that, in a way, saddens me because I would have thought that by now we would see more physicians of color or Black physicians, African American physicians. But I'm finding that here in Cleveland, I actually experience that there's less, and there's a great warmth and a great receptivity. The patients are happy to see us and to be cared for by us, but I do see that there's a greater scarcity of physicians of color here in
Yeah.
Cleveland.
The thing is, in many respects, we are trailblazers, because when the younger generation sees us as Black physicians and surgeons, that actually inspires them to realize that, if we did it, they can actually become a physician themselves. And that's one reason why I wrote, my book, Yes, You Can See It. It isn't difficult to do it if you know how to do it.
Yeah, thanks for saying that, Dr.
Okay.
Modlin, because I think that you are very much like myself. We probably spend a lot of time that is off the records, probably more than we spend with our own children, mentoring and encouraging others to believe that this is something that they can do. I just so happened last night to get a call from a young lady who's 23 years old, and she lives in Chicago. And she texted me and said that she had some questions about going to medical school. She's, sort of trying to figure her life out. And we spent 2 hours on the phone last night, and I told her my story, and she told me her story. And there was a lot of warmth, a lot of love, a lot of laughing, and, just really connection. And you know, trying to help her to see that this is doable. You can do this. And not only can you do this, you must do this because you are very much needed out here. You will save lives, not by luck, but because you have skills and abilities, and also because people will trust you, they will believe in you. And so I think you're very much like me. You're quite willing to invest your time because you know that it's going to be received. And if you make one or two or three more physicians, then you've really made a huge contribution to medicine.
Sure. And speaking of being a trailblazer and celebrating Black History Month, I actually was the first ever Black staff urologist at Cleveland Clinic in nearly 100 years that the Cleveland Clinic had been in existence. Now, since I went over to Metro, there's one Black urologist. He's down at Akron General Hospital. There's one Black urologist at University Hospital. Then there's one Black urologist in private practice. So really, in Northeast Ohio, we really only have 4 Black urologists. I'm actually the only, in the history of Cleveland Clinic, the only, and actually all of Northeast Ohio, I believe actually the entire state of Ohio, I'm the only Black transplant surgeon in the history of the clinic or the whole state of Ohio. So there are a lot of firsts that are occurring. And again, we have to realize that people look up to us as role models. I don't consider myself a role model, but the younger generation does. I'm just a regular guy trying to live up to the expectations of my parents to serve and give back to the community. They taught me to be a servant leader, to use my education to give back to the community, and so that's why I do what I do. Why I feel why I remain dedicated to addressing healthcare disparities in addition to practicing urology.
Well, I would say that you are definitely a role model. They say if you can't see it, you can't achieve it. So just your presence is inspiring. Maybe someone's not becoming a urologist, but they may go into medicine and become a pediatrician or family practitioner or an internal medicine physician or a general surgeon or an anesthesiologist or a urologist or an OBGYN, or they may even become a nurse practitioner or a physician assistant. There's so many options or so many choices. And I think that one of the things that we have to continue to do is pay it forward, because people have helped us. Many people helped me and encouraged me along the way. It wasn't always easy, but it was always rewarding, and it is fun. It is a labor of love. It's a full immersion profession. It's not like, you do a little this, a little that. You get into it, just like, I guess, being an entertainer or a musician or an artist. I mean, you put your whole self into it, and it's a very rewarding career. So yes, you're a role model, Dr. Modlin. Embrace it.
Well, so are you. It's a long journey in becoming a physician, and in my situation, 4 years of college, 4 years of medical school, 6 years of internship and residency. I did 3-year fellowship on top of that. I know your track to your success in becoming an OBGYN was a long haul also, and it takes a lot of intestinal fortitude, a lot of grit, a lot of stamina.
Yes,
you have to believe in yourself. You have to believe in yourself.
I agree 100%. But what I say to people is, number one, time is going to pass anyway. So there's nothing, I think nothing more important that you can do than invest in yourself and help yourself to gain the skills and abilities so that you can invest in other people, so you can help other people. It is hard work, yes, and it was an investment, but I definitely do not regret it. I can't now imagine myself having chosen any other career. It is, again, it's very rewarding, and it's one of those professions that you get to be kind, you get to be good, you get to be loving, you get to bring out the best in yourself to bring out the best in others. You don't have to be a tough, you know hard person. You get to embrace all of the goodness of being a human being, and you can pour that into other people. And yes, the minimum wage is fair. I wouldn't say you'll become rich, but you're fairly compensated most of the time. So I think that it's still a career that is definitely not oversaturated. We do not have too many physicians, and we need people, especially people of color, Black Americans, to take the plunge and go for it.
So I wanted to go back and hit home with this imperative that diversity, equity, inclusion it's not optional, it's essential. So, again, we've highlighted over the years on this platform, the existence, the impact that health inequities, health disparities have on African American populations, burden African American populations, result in lower life expectancies. And that doesn't have to be the case. But a lot of it, again, has to do with distrust of the healthcare system. A lot of times I talk about the Tuskegee syphilis experiment. Not everybody is aware of that. So the Tuskegee syphilis experiment was an experiment conducted by the United States Public Department of Health from 1932 up until 1972. And what it involved was, it was down in Tuskegee, Alabama. A group of public health physicians and caregivers actually, I think it was about 850 Black men. They were following these men who they knew had syphilis. Even though penicillin had been discovered as a treatment and cure for syphilis, they denied these Black men penicillin, which could have cured them, because they wanted to see what the national pathogenesis or national sequelae of untreated syphilis would be over the years. And what happened was, a lot of these men developed tertiary syphilis, secondary syphilis, died from the syphilis. A lot of these men passed syphilis on to their partners. And this leaked out. There was a whistleblower in 1972 or the late 60s. And it leaked out that this was happening. And so, again, there's been a lot of intergenerational memory in the Black community. This is related to, I mentioned African Americans having an unwillingness to even go seek out preventative health care, even when it's in our own best interest. But in particular, African Americans, and we see this, and it's in the literature as well, but we've observed this, African Americans are reluctant, resistant to enrolling in clinical research trials in many situations. And there's only probably about 5% of in clinical research trials involve African Americans. Most clinical research trials involve Caucasian males. And it's important to get more people of color, more minorities, more diverse populations in clinical research trials, because we know that in clinical research trials, if there's more diversity, we can actually determine and develop more therapeutics, more medications that are going to be more effective in certain populations, including minority populations. There's some examples. There's a differential response to the metabolism of some medications in African American populations. There's an enzyme in the liver called the P450 system that actually is responsible for metabolizing a number of medications that we take as patients. And African Americans tend to have a more robust P450 enzyme system. That means in many situations we have to use different medications or higher dosages of medications. In the organ transplant field, immunosuppressive medications, we often have to use a higher dosage of immunosuppressive medications because of the higher metabolism. So again, we know that there's a differential response, and we need more African Americans in clinical trials so we can test whether or not there's any differential responses. There's also a differential response in medication used to treat congestive heart failure in African Americans versus whites. I'm not going to go into all the details, but we do also know that in treating high blood pressure, hypertension, African Americans respond to different classifications of antihypertensives versus Caucasian Americans. So there are a number of reasons that we need African Americans to trust the healthcare system. There's a mechanism when we're talking about clinical research trials to where there are review boards. They call them institutional review boards that review the proposed protocol for the trials, the inclusion, exclusion criteria. So there's oversight. So something like the Tuskegee syphilis experiment would never happen today. I just want to reassure the audience that there's safeguards, that have been placed into the system. But again, the importance of diversity, equity, and inclusion, as we've stressed, is that in many situations, African American communities and patients will feel more comfortable if they see a caregiver, a clinician, a nurse, a physician who looks like them, has shared lived experiences. And again, it relates to improved the quality of conversations and patients, listening and the physician listening and being more compliant, following up, taking their medications, following up with their medical appointments and things of that nature. We can't stress that enough. So it's not optional. This is something we have to push back on this. The fact that DEI is under threat in America, because we're making a case for maintaining DEI in healthcare. Again, it's life saving. There's no question about it.
I agree. And I think that, the larger society might argue that, we need to move on and that we need to forget about the past. But it is not possible to do that because we need to have an understanding of what actually happened. So when we look at the past, how do we explain the fact that we have a shortage of African American physicians? First of all, there's a shortage of physicians overall in the United States. But when we look at doctors of color, particularly African American physicians, there in the not too distant past, there was a time when we were not allowed to enter into the educational system, the larger educational system, to pursue medicine. So Black people weren't allowed to go to medical school. We had to fight to gain access into majority institutions. And beyond that, when we did build our own schools, our own Black medical schools, we were ultimately discredited. Our schools were closed. There was something called the Flexner Report that came out. The American Medical Association basically said our schools were not good, and many of our schools closed. And so now we find in this current day that we have a handful of what we call historically Black medical schools. One is Howard University, which does educate and train many Black doctors. We have Morehouse School of Medicine, we have Meharry, and we have Drew in Los Angeles. But as you and I have spoken about this many times, those schools will not be enough to train the future Black or physicians of color in this country. So we have to pursue our education in a variety of settings in the majority institutions. We're not advocating for our people or Black people to have physicians who are not qualified or who are lesser qualified. If anything, we need doctors who are caring for us who are more qualified because we have, more conditions and we have greater need. So we want our physicians to be well educated, skilled. We want them to be the brightest of the bright, but also to have heart and compassion and empathy and kindness, skills, interpersonal skills that they can relate well to our people. And we want ethical human beings to be in this profession. Um, and we want people to pursue the board certifications and have all the qualifications. So I just want to dispel a little bit of this thought that DEI is about lowering standards. I've never once advocated for lowering any standards. If anything, I think we need the best and the brightest of our people to come into healthcare and to bring their A game to preserving the lives of all people, but especially African Americans, and to try to reverse some of the damage that has been done by some of these majority institutions like the American Medical Association, who has ultimately condemned our institutions, destroyed them, and reduced our opportunities in terms of our numbers in medicine. So, and it's not about, resentment or hatred or, bitterness. It's about, looking at the facts and trying to understand what has happened so that we can move forward as a people as well with pride and with confidence and with esteem, that we are not looking at lesser numbers because we're lesser qualified people or because we are not as smart or we're not as intelligent or we have imposter syndrome. There are some real things that have happened in the United States historically that has impacted the number of or the supply of physicians and advanced practice providers to care for um, people of color or Black people, all Americans. Because ultimately, if you think about it, the fact that there are less Black doctors, that basically means there are less doctors to care for all Americans. But we particularly need us to be in this field because we do have healthcare disparities, which we are uniquely qualified to address because of our cultural background and our concordance with our patients.
And I'll just say one last thing. Being a Black physician comes with extra challenges. In many situations, we actually have to be more resilient because we are Black doctors. Because oftentimes, again, I've experienced this. Oftentimes, people just seeing us. I'll walk into a patient's room, and again, you indicated a lot of times people respond being surprised seeing a Black doctor. A lot of times, people question our validity, our credibility in the fact that we are Black doctors because we're so far, few and far between. It does take a lot of resiliency because Black doctors don't have a lot of other Black doctors to use as sounding boards, as mentors, as colleagues and stuff. So that's why we have to mentor one another, uplift one another. But the audience needs to understand there's certain challenges that actually come with being a Black physician, and we all need to support one another. We need to support the pipeline programs also. I'm part of a board here in Cleveland. It's called Health Legacy of Cleveland. We actually raise money and to provide scholarships for students of color to enter the health professions, medicine, dentistry, nursing, whether or not they want to go into the business aspects of healthcare as well.
Thank you for saying that, Dr.
Yes.
Modlin. I think that when I think about excellence among African Americans, I would dare say that almost anything we pursue, we are going to be challenged, and we will have to meet it with some resiliency, and we do need support. It's not going to be easy, and I would dare say that you are going to meet some bias and some discrimination, and you do need to have your support. You need to internally be strong as possible, and you need to have your board of directors, as they call it, your people around you, your 3-4 people who will have your back and who support you. And the other thing that I appreciate that you're talking about is those of us who have been able to I guess make it, for lack of a better expression. We are obligated, I think, to reach back and to pay it forward and to not let it be about our ego, but to maintain a sense of humility, because this is a service career. We're in service to our humankind and to people. And we need to think of ways that we can lessen the burden on the next generation. And one way I like is the legacy board that you invited me to participate in. And then also ways that we can raise money and take away some of the financial burden, because it is expensive to pursue these careers. There's quite a bit of education. Many times we don't come from families who can just pay the several $100,000 for the career, so we're borrowing money. So I think that those of us who are out here and those in the audience, if they can contribute to college scholarships, save your money, even if there's not a formal program, reach out and touch one of your family members and try to contribute to lessen the financial burden. Maybe give them a little $500 gift card if you can put that money together to help lessen the burden. Anything you can do to contribute financially, I think, would be beneficial, so that you're not strapped with a long-term financial burden of pursuing advanced education.
So, we're going to close here, but I wanted to say I grew up in a little central Indiana town called Newcastle, Indiana. I wasn't out there in that exciting LA, Southern California like you were, but I actually never met a Black doctor growing up. The first Black doctor that I saw was actually a TV Black doctor. His character was named Jackpot on Trapper John MD. And then the second Black doctor was Denzel Washington on the show St. Elsewhere. So the first real Black doctor was a gastroenterologist at Evanston Hospital at Northwestern that I actually met in medical school. But
Well,
yeah, I wanted to, yes.
if I can just take a moment and share something personal with you, I was about 15, and I had a wonderful dad. He was a very kind man, very gentle man, and he came to me one day because, it might sound a little personal to the audience, but it's not such a personal thing to me. I'm a gynecologist, so we talk about these things often. So I had reached the ripe old age of 15, and I hadn't started my menstrual cycle. So my dad came to me and said, I need to take you to a doctor because I have an understanding that by now you should have started your menstrual cycle. And I said, oh my gosh, what does this mean? I just remember having the fear of God in me, like, oh my God, somebody's going to look in my private spaces. And so my father said, I said, well, is it going to be a lady doctor? And he said, I don't know if I can find a lady doctor. And so then he went away for about a month, and he came back and he said, I found a lady doctor who's going to be able to see you. And I said, is she a black lady doctor? And he said, I don't think I can find a black lady doctor. And my father went away. It seemed like it took another 3 months, and he found a black lady doctor in Los Angeles and took me to see her. And I remember to this day, I wish I knew her name, but I don't know her name. I still remember how she looked. She was the most beautiful lady I could imagine at the time. She was chocolate. She smelled so pretty to me. And she took so good care of me. She was very respectful, very kind, very gentle. She talked to me about my body and what to expect. And she told me I was normal. And I said, oh my gosh, I'm normal? Yes, you're normal. And I never forgot that image. And I think to this day, that is why I pursued obstetrics and gynecology, because I enjoyed that relationship, that one-on-one relationship between the gynecologist and the patient. And I've tried to be that type of physician who can connect with the patient and who shows a lot of caring and a lot of respect for women. And I think that we definitely need that, and we deserve it. So that was my first time seeing a black doctor
Okay.
as a gynecologist.
And it wasn't so easy to find one.
No, it was not.
But yeah, no. So again, I
But
think
I
this has
do
been,
want to say,
yes.
that it was my father. Sometimes the black man doesn't get the props that he always deserves.
Yeah.
And it was my father who was patient with me and was caring and found me. I don't know how he did it because we didn't have the internet back then. He probably had to ask 101 people,
Yeah.
but he made sure that I felt comfortable and that I was cared for. We didn't have health insurance. I don't even know how he paid for it, but he knew that that was something important for me to have an opportunity to be evaluated. And, so I wanted to be that type of doctor.
You never know what kind of impact you're going to have on a young person. So we always want to maximize that impact and make it as possible,
And I
as
will
positive as
say,
possible.
just to give you a shout out and give you some props, you have sent me several young Clevelanders who somehow found you called me on the phone and said, Dr. Modlin said, call. One young lady I see right now, she's a student at NeoMed. You happened to run into her one day at a coffee shop. And now we have a mentoring relationship. She wants to be an OBGYN. So, it's something that I know that you live by, and it's something that we share, and we have to continue. I think until the day we die, we have to continue this message that this is a rewarding career. It is hard work, but you're gonna receive so much more than you give. You're gonna give a lot, but you're also going to receive a lot as well from your patients.
Yeah. And the community really relies upon us for advice on a daily basis. So I wanted to thank you, Dr. Moreland, for being part of the platform, Music and Medicine. I think we've covered a very important topic, the imperative that DEI in healthcare is it's not optional, it's a requirement for the elimination of healthcare disparities. I wanted to close out reminding everybody of this very important book, I think, which can be very instrumental in the hands of a young person, parents, teachers, coaches, mentors, advisors, libraries. It's called Yes, You Can Succeed. It isn't difficult to do it if you know how to do it. It's the step-by-step definitive how-to roadmap to achieve your success goals. I really highly believe in the content of this book. Like I say, they should have put a better-looking guy on the cover.
Well, you got to give me a copy of that book, Dr. Modlin, because I believe this exactly in the title that you've named your book, and maybe I need to write one too, because that's what I've been preaching along the way here is that if I can do it, you can do it. If I had a title for my book, I would say From the Ghetto to Gynecologist. Even though I'm from LA, it's not the glamorous world. It's South Central LA. The neighborhood that Kendrick Lamar, he's from, they'd say the West Side. And, it was a very blue collar community. And, but I had parents like yourself who did their best to instill in me good values.
Mhm.
And they tried their best to make sure that despite their limited resources, they put me in the best educational environments. They didn't push me, but they made sure that um, school was important, and that you know, um, I was commended. I was encouraged. That's what I should say, to do well in school. And so I think that we need to continue that type of approach with our children, and we don't want to push them or break them, but we do need to encourage them to continue to reach their potential. So I would say my book would be called From the Ghetto to Gynecologist. If I can do it, you can do it, and it's rewarding as well.
Yeah, get started on that. This one took me about 4 years to write because I didn't have a lot of time, but yeah, get started on it.
Well, I got to read yours, and
Okay.
You have to give me some pointers. See, look, you're mentoring.
Okay. You got a copy that I'm gonna give to you.
Okay, I need it signed.
Okay, absolutely. So we're going to close out the program with our musical artist, Jerome Mitchell. He's a guitarist. He's been on the platform before. I've seen him perform live in Cleveland. So thank you to Jerome Mitchell for being with us as our entertainer. Thank you, Dr. Connie Moreland. Thank you, Russell Johnson, our producer from Liquid Raw. We're going to see all of you on Music and Medicine in the near future. Please share, like, subscribe, and blast this podcast out to everybody so they can absorb and learn about this important content. See you next time. Thank you.
Thank you so much for having me, Dr. Modlin.
Thank you, Dr. Moreland. Beautiful. Thank you. Thank you. So, Jerome, actually, where are you going to be performing?
I'm going to be performing on Valentine's Day at Flavor in Garfield, Ohio, from 7 to 9. And I'm going to have some guests coming there. I'm going to have my two cousins. They can really sing.
Yeah.
So I'm glad to be home so I can actually have my family and play with my family while I'm here in Cleveland.
I think your one cousin, she plays drums also, if I remember, percussion.
Yeah, she's gonna come and
Okay.
sing, and I have another cousin that plays piano, but he's gonna sing too. So they're gonna sing to the lovers in the house for Friday for the 14th at Flavor.
And you
So it
didn't tell
might
the
be
audience. What do you didn't tell the audience that you sing as well?
well, I stick more to guitar.
No, you're great. You're an excellent singer. I've heard you. So
I'm glad you enjoyed Dr. Modlin. I really do. Thank you very much. I think I should have used my phone for the platform instead of my computer. So this seemed like this work.
well, we're going to have you back again and again and again and again. So
Well,
thank you.
just let me know and I'm available anytime for you, Doctor.
Okay.
What was the title of that piece of music?
That piece was done by Funkadelic. That was Eddie Hazel playing the guitar out of Plainfield, New Jersey. So that was the beginning of Funkadelic when Funkadelic was more like a rock band. So I had a pleasure to live in Plainfield, New Jersey for 40 years. And I got to ride on the mothership, as some would say. So I wanted to do a tribute. And just it was a real mellow song, more like heartfelt. So I felt that could deliver it for it to it would have been appropriate for tonight.
I thought it was beautiful,
Was
and it speaks to the fact that when we talk about healthcare, we need a different type of healing, and sometimes music does that. It calms us down and it takes us to another place that even doctors can't treat.
And I call myself a doctor on the guitar.
yeah, music. Yeah, music is medicine. So
Yeah, music's a healer. And
it is.
I truly believe that because my mother and my father, they gave me God to take with me with this instrument. And that's all I had to rely on. So it's all about the love and to and I know that these notes are healing notes and healing tones because these frequencies are like medicine. I'm not a doctor, but I know that music do heals.
It does. No question about it. So thanks for being here. And then we're going to see all of you in the listening audience again very soon on Music and Medicine. Thank you.
Thank you.
Have a good night.
Good night.
Good night, everyone.
Yep.
Thank you.
Thanks.